Question number 51. A steroidal antibiotic. Which of the following is a steroidal antibiotic? Options are fusidine, aminophylline, bacitracin, clindamycin. Option correct answer is fusidine. Fusidine is a steroidal antibiotic. Bacitracin is a polypeptide antibiotic. Clindamycin is coming under lincosamide antibiotic. Okay, lincosamide antibiotic. From the word itself, it is there. Lincosamide. Bacitracin is polypeptide, but vancomycin is glycopeptide. Okay. Now we are moving to the next question. Question number 52. The preferred treatment of status epilepticus is intravenous administration of. This question is repeated in many question paper. Okay, the preferred treatment of status epilepticus is intravenous administration of. Options: ethosuximide, sodium valproate, diazepam, chloramphenicol. The correct answer is 52. The correct answer is option C, diazepam. Okay. Question number 53. Bromocriptine is used to treatment of amenorrhea. To treat amenorrhea because bromocriptine is used to treat amenorrhea. Options are: stimulate the ovary, it stimulates the GnRH release, it suppresses the prolactin release, it stimulates FSH release. The correct answer is it suppresses the prolactin release. Bromocriptine will suppress the prolactin release. Question number 54. The primary mechanism of action of local anesthetic is the blockage of. Options are potassium channel, calcium channel, sodium channel, all of the above. Correct answer for the 54th question is option C. That is, local anesthetic will block sodium channels. That is the mechanism of action of local anesthetic. Next question, question number 55. Long-term use of glucocorticoids induces. Option: hypotension, hepatotoxicity, osteoporosis, bradycardia. The correct answer is osteoporosis. Long-term use of glucocorticoid will induce osteoporosis. 55. Option C is the correct answer. Question number 56. Clomiphene citrate or clomiphene is used for the treatment of infertility because it stimulates LH secretion, follicular development, ovulation, uterus activity. The correct answer is option C, ovulation. Clomiphene is an anti-estrogen. Okay, anti-estrogen or estrogen antagonist. Clomiphene citrate. Question number 57. Isosuprene is used for the treatment of. Options are asthma, severe hypotension, and nasal congestion, then premature labor. Isosuprene is used to treat premature labor. Correct answer is option D. Question number 58. The phenomena of invasion and destruction of the tissue is known as. Options are natural immunity, acquired immunity, pathogenicity, parasitism. The correct answer is option C, pathogenicity. Next one, 59. Organism that can grow on organic matter from dead plants or animals are called. Options are saprophyte, parasite, psychotrophs, mesophil. The correct answer is organism that can grow on organic matter from the dead plants or animals are called saprophytes. Okay. Parasites we know. Psychotrophs are they are the cold tolerant bacteria, that is they have the ability to grow at low temperature. Bacteria which will grow at low temperature is known as psychotroph. Mesophils are organism which is growing in moderate temperature. Okay. Now question number 60. Glycerol may be used as a preservative in the percentage of. Options are 15, 50, 1.1. Option B is the correct answer. Okay, question number 60. Glycerol in 60% can be used as a preservative. Okay, question number 61. We are moving to the question number 61. So now you understood that most of the questions are simple and they are just asking the basic concept. But anyway, you have to study well. The microorganism that can enter the body only through an injury is. Question number 61. The microorganism that can enter the body only through an injury is Salmonella typhi, Clostridium tetani, Clostridium botulinum, then Streptococcus pyogenes. Only through injury is Clostridium tetani. tetane. Okay, the correct answer is option B. Question number 62. TAs contain an antibacterial enzyme known as zymase, diastase, lysozyme, then lipase. Option C is the correct answer. Lysozyme is there in the tear, okay, in eye. One another thing is there lysosome. This is the lysozyme. Now another one is lysosome. Lysosome is lysosome. I will write it here. Lysosome, which is present in the cell. Okay, it's a membrane bound cell organelle. It's a cell organelle. Okay, which is found in the inside the cell. Okay. Question number 63. Protein deficiency diseases is known as. These are the simple general science questions. Okay, protein deficiency disease is known as Cushing disease, Fabry's disease, Parkinson disease, Kwashiorkor marasmus. Kwashiorkor marasmus is protein deficiency disease. Okay. Question number 64. Glycogen is present in all the body tissue except options are liver, kidney, brain, stomach. Option B is the correct answer. 64. Brain. In brain, glycogen is not present. Now the question number 65. The conversion of carotenoids to vitamin A take place in option intestine, option B liver, option C kidney, option D skin. The correct answer is in the intestine. Question number 66. The precursor of bile salt, sex hormones and vitamin D. Vitamin D we study this steroid. So steroidal structure. Sex hormone also got the same structure. Okay, so diazonic cambasterol, cholesterol, ergosterol. The correct answer is cholesterol. Cholesterol is the precursor of bile salt, sex hormone and vitamin D. Question number 67. International Enzyme Commission classifies enzyme into 3 classes, 6 classes, 4 classes, 10 classes. International Enzyme Commission classifies enzyme into 6 classes. Okay, they are converted into 6 classes. For this you can see here they are hot lil. That means H represent hydrolysis. Okay, hydrolysis, oxidoreductases, transferases, lyases, isomerizes, ligases. Okay, one more thing I will repeat. H represent hydrolysis, oxidoreductases, T represent transferases, L represent lyases, I represent isomerizes, again last L represent ligases. This is the 6 classes of enzyme according to the International Enzyme Commission. Question number 68. Platelet contain an enzyme which has an important role in clotting of blood. This enzyme is known as cholinesterase, transaminase, decarboxylase, thrombokinase. The correct answer is option D. Thrombokinase. Okay, thrombokinase. 68. Question number 69. Cobalt is a constituent of folic acid, vitamin B12, niacin, biotin. Vitamin B12 is the correct answer. Cyanocobalamin. Vitamin B12 name is cyanocobalamin or methylcobalamin. They are calling us methylcobalamin or cyanocobalamin. You can see the cobalamin. That is the cobalt. Okay. Now we are moving to the 70th question. In the process of transcription, the flow of genetic information is from DNA to DNA, DNA to protein, DNA to RNA, DNA to RNA to DNA. Transcription, that is the question. Transcription is DNA to RNA. Correct answer is 70. C is the correct answer. DNA to RNA is called transcription. So what is translation? Translation means protein to RNA to protein. That is here there is no option, that one. RNA to protein is translation. Okay, then one is there DNA replication. Replication means division, that is DNA to DNA itself is known as, this is the replication. Okay, replication, DNA replication. Okay, Then RNA to protein is called translation. Okay. Now we are moving to the 71st question. Milk is deficient in which mineral? Phosphorus, sodium, iron, potassium. The correct answer is iron. 71. Option C is the correct answer. Now the question number 72. There will be total 80 questions. So this what are the important topic and syllabus for this exam we already covered in the previous video. Okay, the first video. So the question number 72. Unopened insulin is stored at. Unopened insulin is stored at. Options A -1 to -5 degrees Celsius, 2 to 8 degrees Celsius, 15 to 20 degrees Celsius, 20 to 30 degrees Celsius. The correct answer is in the freezer. In the fridge we have refrigerator. We have to keep this unopened insulin, that is 2 to 8 degrees Celsius is the correct answer. Question number 73. Glargine. Glargine is an insulin type. Okay. Glargine is short-acting insulin, intermediate-acting insulin, peakless insulin, oral insulin. This is important question. Classification of insulin is one of the important question. Many question paper have this question. They will give. Maybe they will ask what is the which of the following is a short-acting insulin, and they will give the examples. You have to select the correct answer. Otherwise, they will give the name of the insulin and they will ask for the duration of action, that is short acting or intermediate or long acting, like the peakless insulin is also known as long acting. Okay, they are also called long acting. Okay, and the correct answer glargine is a long acting insulin, that is option C is the correct answer. Peakless insulin is the correct answer for this question. So before going into details, before going to the next question, I will give you some example for rapid acting. They are classified into rapid acting, short acting, intermediate acting. Short acting is a regular insulin. Okay, regular or soluble insulin. Regular or soluble insulin. Okay, and intermediate acting insulin is example is NPH insulin, or it's also called isophane. Okay, then lente insulin or also intermediate insulin. Then rapid acting insulin example are lispro, aspart, glulicin. Insulin lispro, insulin aspart, insulin glulicin are example for rapid acting. These all things are there in the classification of insulin. Okay, in the anti-diabetic drug, you can check in the pharmacology textbook. Whichever you are using, you will get it there. In that textbook, it will be there. Okay, now we are moving to the question number 74. Metformin options are sulfonylurea, DPP4 inhibitor, biguanide, glucosidase inhibitor, alpha glucosidase inhibitor. Metformin is a biguanide. Question number 74. Correct answer is option C. Now we are moving to the next question. Question number 75. Enalapril is options are angiotensin receptor blocker, calcium channel blocker, beta blocker, angiotensin converting enzyme inhibitor, that is ACE inhibitor. The correct answer pril is ACE inhibitor. Okay, enalapril is a ACE inhibitor. So another one is the ARB, that is angiotensin receptor blocker, that is example is losartan, valsartan. You can see the sartan in the ending. Okay, valsartan, losartan. Okay, all are angiotensin receptor blocker. ACE inhibitor they will end with the name of the ACE inhibitor will end with the pril. Enalapril, lisinopril. Okay, all are ACE inhibitor. Now we are moving to the question number 76. In primary vaccination, DPT is given as primary vaccination, DPT, diphtheria, pertussis, then tetanus. Diphtheria, pertussis, tetanus. This vaccination is against diphtheria, pertussis and tetanus. So in primary vaccination, DPT is given as 3 doses at 1 month interval, 3 doses at 3 month interval, 5 doses at 1 month interval, single dose. The correct answer is 3 doses at 1 month interval. 76. Correct answer is option A. Now question number 77. The following are NSAID. The following are NSAIDs except ibuprofen is an NSAID, diclofenac is an NSAID, ketotifen, pyroxycam is also NSAID. Ketotifen we are studying in the drugs against asthma, that is mast cell stabilizer. Ketotifen is a mast cell stabilizer. So here the question is, which of the following is which of the following are NSAID except which of the following is not an NSAID, that is ketotifen. Now question number 78, dextromethorphan is used in the cough syrup as this is from the classification. Options are expector and mucolytic bronchodilator suppressant, and dextromethorphan is a suppressant. Dextromethorphan is a suppressant, cough suppressant. Question number 79, the following are proton pump inhibitor except. You can see different question, many question from the classification. So here the following example, following are proton pump inhibitors except omeprazole, pantoprazole, rabeprazole, albendazole. The correct answer is albendazole, even though it is there zole, but there is no prazole. So proton pump inhibitor, the name will end with prazole. Omeprazole, pantoprazole, rabeprazole. Okay, all are prazole. They are esomeprazole. All are proton pump inhibitor. But albendazole is a drug against helminths, anti-helminthic drug. Am I correct? Albendazole, mebendazole, all are anti-helminthic drug. They are used against the worms. Question number 80. Question number 80, the last question of this question paper. The following are true of National Pharmaceutical Pricing Authority, NPPA, except. Options are, it is a statutory body. Option B, it can fund studies regarding pricing of drug. Option C, it monitors drug shortages and takes appropriate action to rectify it. Option D, it collects and maintains data regarding the import and export of drug. Which of the following are true of National Pharmaceutical Pricing Authority except. So which of the following is wrong statement about NPPA? The correct answer for this question is option B. It can fund studies regarding pricing of drug. NPPA cannot fund studies regarding pricing of drug. Okay, so these are the multiple choice questions which is asked for 2017 ISRO Vssc Pharmacist question paper. So this by watching this video you came to know that these are the simple questions, mainly pharmacology, and in the pharmacology classification is the main topic. All the very best. Okay, thank you very much. And one more thing, if you didn't subscribe my channel, please subscribe, and also press the bell button for the notification. That definitely will help you.